Okay, so this is Lindsay. How did we meet? I think we had through the cheerful pelvis, right?
Yes, I know that you had connected with a colleague of mine a little while ago. I work at the Cheerful Pelvis, which is a pelvic floor specialty clinic, physiotherapy clinic here in Vancouver, BC. But I've just been hanging out in your group for a while and just sitting back and listening and taking part in conversations. And I reached out and thought that this would be a fun thing to do.
Yeah, I'm glad that you thought it would be fun. I actually really enjoy sharing information with people myself. My dad was a piano player and a composer. There was always music going on in our house, and he was always teaching. And now, as an adult, trying to figure out like what is my problem. My problem is my parents were always teaching. They were always learning. My mom and my dad were really into, well, they call it now unschooling, right? Where you just go based on your interest.
Hmm.
And they were doing that. I was born in 1970. So anything I was ever curious about, we just went to the library and asked a lot of questions and talked to their friends. And so that's just kind of how I am, and how this whole thing ended up happening is starting the group and then realizing, oh my goodness, none of us have any idea what the heck is going on, but we're going through all these crazy, very troubling symptoms. And the bladder stuff is, I think, really impactful because, well, this is the one that really got me when I think it was Mary Claire Haver was talking about the stats on women being placed for long term care.
Hmm.
And the most common concern for that was that they were incontinent.
Hmm.
And I was like, what? Are you serious? Because it is treatable. There are, there are pelvic floor physiotherapists, and maybe we don't really, it hasn't risen to the top of the consciousness of people to know that that's an option. And my doctor certainly never suggested that. I talk to everybody about what's going on, and I just happened to mention to my physiotherapist who was working on my tendonitis in my shoulder, and she said, "Oh, I also do pelvic floor physiotherapy. So if you ever have any problem, just come see me." So the moment I did, I went to go see her, and 2 or 3 sessions and some homework, and you know, here we are, doing quite well. Also using some vaginal estrogen cream. Super lucky that I was just offered that and that I didn't have any, resistance, because I was trying to figure out what is my deal. Why have I been just so open to trying supplements and open to trying medications and open to doing the lifestyle stuff? And it's because I had no preconceived ideas about any of it. I was like, okay, I'll just try it and see what works and what doesn't. So I'm in the group, running the group as a peer of the group, but also making these connections like, okay, we need this, and we need to know about this, and we need to know about that. So I really appreciated talking to you a little bit about working with pelvic floor physiotherapy, but as a holistic practice. So do you want to say a little bit about that? Because I found that really exciting.
Yes. Oh my gosh. I would love to just dive in. First, well, here are the things that I was thinking that we could like talk about is like just even backtracking and just talking about like what is incontinence, what is going on with the bladder that so many of us are experiencing around perimenopause and menopause. Yeah, I'd love to talk a little bit more about the impact of that leaking. Like you said, one of the number one reasons for women being admitted into long-term age facilities is incontinence. And that is a big lifestyle change, a big change from their autonomy, their social connections, their that sort of thing. So that's one of the impacts. Why does it come up around menopause? There's some pretty interesting things around that. And then I would love to even talk about like, well, what can we do about it? Because
Yeah.
there's so many things like what I can do and what anybody can do that even, if you are peri or post menopause, you can absolutely make changes. So yes, so I've been working in the health and wellness industry for about 20 years now. I've been working directly with patients and clients as a physical therapist or a physiotherapist that we say here in Canada for about 15 years. My undergrad degree is in exercise science, and I'm a certified clinical Pilates instructor. So, just like you, Jessica, I love using movement as medicine, and that is a big part of what can get rid of so many bladder issues. And I was an orthopedic physical therapist for many years before getting into pelvic health. So I worked with the knees and the backs and the necks and all the car accidents. And so I really found that this set me up to have this bit of a superpower in being able to connect the dots between other parts of the body and other systems to when it comes to the pelvic floor and bladder issues. And so I have been teaching courses and mentoring junior physiotherapists since about 2013, which I still do in the clinic, the triple pelvis. And I've worked alongside the GPs and the gynecologists and the urogynecologists. But what really brought me to be really interested is that I myself, like, I love how you said, Jessica, like I was a peer among everybody. That's me too. Like, I'm very, very fully perimenopausal right now. And even before I was perimenopausal, I had bladder issues just like the ones that we're going to talk about. And when I had that, I went to the doctors, I went to the physios, the standard traditional pelvic floor physios, and I got the standard advice. I was told to do more Kegels, to squeeze harder. I was just weak, and that was going to fix things. But it actually made my bladder issues way worse, way worse. And I see this all the time because it's not just about a weakness thing. It's not just about, oh, you're getting older so that your pelvic floor muscles are loose or weak and that sort of thing. And we're going to dispel a lot of those myths today because I'm a walking myth dispeller right now. And I think
Yay!
many of us out there are probably going to have the same story as me.
Yeah, that's amazing. You have such a great, varied background, and you definitely don't look old enough to know all of the things that you know or to be in perimenopause. But that is one of the things that I'm kind of working with. How I educate people is that like just this morning there was a picture shared from 9 years ago when I was doing a concert with my dad, a house concert, and I remember that day because I woke up and now I know that was all perimenopause.
Mm.
At the time I was like, what the hell? Like I laid down on the floor and cried after I had dinner, and both my husband and my dad were sitting there. We have to go play a show. Like, um,
We don't have time for this.
are you going to get up off the floor? And I was like, well, yes, of course, because we have actually this word performative has got a negative connotations, but there is a lot of positivity to being able to do that, to pull yourself up, get yourself together, go and play a show. And then I didn't feel so bad by the time the show was done. But that's a long time to be going through perimenopause, and it can take a toll on the body, especially if you don't really understand what's happening with those bladder changes. And it can be super embarrassing to talk about. So that's another reason why I want to talk about this stuff, because we all have a bladder. We're not embarrassed to put on our glasses
Hmm.
or use moisturizer. So, you know, let's have a conversation and just be frank about the whole thing.
Absolutely.
Yes.
We need to get rid of that taboo. Absolutely. It breaks my heart because I speak to women all of the time who have had significant bladder issues for years, sometimes decades, and I'm the first one that they've told about it because they either believed or were told that it's not appropriate to talk about it. So I'd love to just break those walls down like this conversation today and just like put it out there.
Yeah.
Absolutely.
And
Yeah.
I mean, there is like, I always tell people ask for help, but ask the right people for help, right? Like maybe the Walmart greeter isn't the person to ask about your bladder, or maybe they are, right? Because I have told people, like if there's one of the resources you can utilize is the pharmacy technicians. They're not pharmacists and they don't have as much training, but they work with the clients and they're really customer based. So they'll maybe know some things about who's providing treatment in your area, and so they're technically not a doctor or a pharmacist, but they are very knowledgeable and they're available, and usually they have a little bit more time because they're working with customers. So talking about it, I think, is really, really important, and hopefully will shed some light. And my whole thing is if I can help one lady to understand her body a little bit better every day, then I'm I'm sharing my light in the world, right? I'm helping people, which is really important to me just in general. Probably also again from my parents, the way that they were.
Absolutely.
And
Absolutely.
so, did you prepare something for us? Were you going to give
I
us a little?
do. I
Ooh,
did. I do. Well, let's first just talk about what are these bladder issues that we want to talk about. First, let's talk about urgency, or people will call urge. Urgency means that your bladder's not whispering to you. You have a very sudden, strong sense, I need to get to the bathroom. It's urgent. For a lot of women, it's uncomfortable and stressful or painful. That is not normal. It's common. Yes, it happens to a lot of people, but it's not normal. We should get the slow building of a sense that we need to pee. And if we leave it too long or can't get to the bathroom, it can creep in its intensity, but it shouldn't be this sudden, strong urgency. That's urgency. When you hear the term frequency, that is, I'm going to the bathroom more frequently than what I should be. We should be able to hold our urine for about 2 to 4 hours comfortably. So when you're going every half hour, every hour, then this is what we would call frequency. We're going too often. Now, incontinence is when you have a loss of any urine, a leak of any amount of urine that you didn't want to. It can be a small little dribble or it can be a full bladder release. And I like to make that clear because a lot of women don't believe they have incontinence because they don't have their full bladder release and they don't need to wear a pull-up or a diaper. The thing is that if you sneeze or cough and you leak and have a little dribble, if you have just little dribbles here and there, that's still called incontinence. I will bounce around between incontinence and leaking just simply because a lot of the women I talk to, they more connect with the word leaking because they still don't believe that they're incontinent, if that makes sense.
yeah, I get that. Yeah, there was
Yeah.
one story that was shared. I don't know if you saw it, but someone waiting in line at the checkout and having a full bladder release just out of the blue.
Yeah.
And she was lucky enough that the lady on the other side of the checkout was actually really very sympathetic and hurt the person behind her wrapped a sweater around her waist so that she could finish her purchase and go on her way. But mortifying, right?
Absolutely. Absolutely. So, incontinence, there's a couple different types. The three that we'll talk mostly about today are stress incontinence, urge incontinence, and mixed incontinence. So, stress incontinence isn't just about mental stress, although that can play a big part, but it's more like the stress or the force that goes through the body. When you have a certain force that goes through the body that can cause leaking, we call it stress incontinence. That really comes down to a pressure game. If the pressure inside of the bladder is higher than the pressure closing the bladder, you're going to have leaking. So if I filled up a water balloon and I didn't tie a knot on the end and I handed it to my son, the water would come leaking out because the pressure inside of the balloon is higher than the pressure closing the balloon. Now, what the traditional outdated systems will tell us that it's all an issue around the closing, the knot of the balloon, the closing of the balloon, the weak pelvic floor muscles. Absolutely, that can be an issue, that there could be problems with the closing, the pelvic floor muscles. But there can be a lot of other things that are putting an excessive amount of pressure inside of the bladder, like our posture and our core muscles and the way that we breathe or don't breathe, where our diaphragm is doing, all these sorts of things, which we'll dive into a little bit more. But that's stress incontinence. Then there's urge incontinence. Urge incontinence is much more mixed. It's very nuanced. It's much more about the nervous system and the brain bladder connection. And so urge incontinence is when you get that sudden urge, probably like the woman that you talked about in line. We tend to see bigger leaks, like my whole bladder, although you can have like smaller urge leaks as well, but you get that sudden out of nowhere sometimes urge that you need to pee. And if you can't get to the toilet straight away, you get leaking. So what is happening here? So the bladder is a hollow muscle or hollow organ. Its walls are muscle, thick, strong muscles. And in those muscles, there are sensors. They sense how full it is. In a normal bladder, what happens is that it fills until full, at least 2 to 4 hours full, and then it triggers those sensors that send a message up through the nervous system. And when I say nervous system, I mean your brain, your spinal cord, all of the nerves that go to the rest of the body, and the messages that they send back and forth. So it triggers the sensor, it sends a message up to the brain. And in a normal bladder, there's a helpful connection between the brain and the bladder. So it'll whisper to you, hey, you need to go to the bathroom. But remember what I said, it's mild, it's comfortable. Maybe we can ignore it because we're paying for our groceries at the till. But then eventually you make your way to the toilet, you sit down, you relax the pelvic floor muscles, which opens up the tube where the pee comes out, the urethra. And then those muscle walls of the bladder will squeeze, and that's what brings the urine out. Make sense so far?
Mm-hmm. Yeah.
Okay. So when these things get out of balance, what I call pelvic system imbalance, we can get what I call a bossy bladder. So in a bossy bladder, those sensors become too sensitive.
Mm-hmm.
So at a very low volume, less than 2 hours, it kicks off that message through the nervous system. And there's an unhelpful connection between the brain and the bladder, which means it'll yell at you. You must get there right now. It's stressful, uncomfortable, panicky, maybe painful. On top of that, the bossy bladder does not wait until you're on the toilet. It starts to squeeze those muscle walls before you get there. So at that point, not only do you need to have like a normal pelvic floor, you need to have like a super pelvic floor so it can keep that tube closed where the pee comes out despite all that squeezing.
Mm-hmm.
So with urge incontinence, it's much more about that brain bladder connection. But sometimes it has nothing to do with how much volume is in there because you can get triggered by things like arriving home, trying to get through your front door, parking your car, getting your key in the front door, getting ready for bed, brushing your teeth, hearing, seeing, or feeling running water, like washing your hands or dishes, stress. If you walk past a bathroom, there's a lot of people who are like, okay, I'm really urgent. I need to pee and I can hold it until I get just in front of the toilet and then it lets go. And so your bladder and your pelvic floor muscles don't have eyes or ears. They don't know that you're at your front door. They can't hear the running water, but your nervous system can. And so this type of incontinence, this type of urgency, doing Kegels, not going to fix it. This is not a strength of your pelvic floor muscles issue. This is a nervous system issue. Does this make sense? I'm
Yeah.
hoping there's some
Yeah.
aha moments happening for some people.
Takes mint. Yeah, for sure.
Yeah. Yeah. And so then we can also have mixed incontinence where, and this is where actually most of the women I work with have both. So they do laugh when, or sorry, they do leak when they laugh or cough or sneeze, yes. But then they're also having these other types of urge leaking. That's what we would call mixed. And then you can have functional incontinence where everything's working kind of well, but I'm too slow to get to the bathroom. Maybe my mobility isn't good or the dexterity of my hands, I can't get my clothes off fast enough. So it's like normal function. I just can't get there fast enough. Or maybe I'm bedbound or in a wheelchair or
Mm-hmm. Mm-hmm.
something. And then we have overflowing continence. This one I'm not going to dive into, but if you're unable to fully empty your bladder, it's always a little bit full, and we can just get like this overflowing continence. But that can be for completely unrelated things that we're going to talk about today. We're going to talk mostly about that stress incontinence and urge incontinence. Does that make sense so far, Jessica? Any questions that you have about any of this coming up?
No, I've just kind of been there, you know. I've had my own um, bossy bladder, and like one of the things that I discovered was when I let my bladder dictate to me, then I end up with an unhealthy relationship with my bladder, where my bladder is just going to tell me what to do all the time. So, not that I don't try and hold that until I'm really uncomfortable, but I will kind of check, okay, like do you know what I mean? Like, did I recently go? And then if I go to the bathroom and realize that my bladder wasn't really full, I'll definitely try and wait the next time so that
Hmm.
I'm like retraining the bladder to actually fill before it's telling me that I need to go. And that
Absolutely.
really made a big difference. And also just understanding that a lot for me with the condition of the pelvic floor, it was more tightness where the
Hmm.
muscles were fatigued from being too tight.
Hmm.
And so I had to work with that and learn to release the muscles and just, I think, stay on top of it, like Don't don't ignore something like your bladder health, because it will have this, I mean, that woman who was who lost control of her bladder waiting in line, she might have been so traumatized that now going to the store is hard for her. How are you going to function if you're afraid to go to the store? That makes
You're
everything
that
so
and
much
that, and
harder.
that's exactly what I hear is that all you need is to either have fear that an embarrassing moment is going to happen or an experience that it has happened, and then you're not going to want to do these things. And so it's
Yeah.
a great segue into the impact. Absolutely, there's a huge social impact. I don't want to go anywhere that there's no like access to bathrooms. What if I have this big leak again? What if people can see my pad? What if people can smell my pad? What if I can't
Mm-hmm.
change my clothes? All of these things. And so people start to kind of shrink back and not do the things that they love to do. So not only is their daily quality of life decreasing, but we know that social connection is really important for cognitive health as we age as well. So that's a big one. And the tricky thing is that the nervous system will learn. If you had a really big leak in the grocery store, your nervous system is going to remember that's a big, scary place for you. So you are much more likely to have urge sensations and that bossy bladder squeezing again in that grocery store just by sheer nature of you being nervous of it, which is why some people will have really strong certain triggers that they go into.
Mm-hmm. Yeah,
Yeah.
I just had someone comment, that they're not getting the tingling sensation, but sometimes leak mostly when walking.
Yes. Yes. We're going to talk about that as well. But yeah, so we talked about the cognitive health and social. We talked about the nursing homes or the long-term homes. But let's talk about urinary tract infections.
Oh yeah.
Incontinence is directly related to that. In fact, up to 10% of postmenopausal women will develop a UTI that requires hospitalizations because as we age, what happens is that our UTIs show up quite differently. When we're young, UTIs are like my lower abdominal area is uncomfortable. I have this burning or pain sensation when I pee. I'm going pee often, or I have to go pee urgently, and sometimes have a little bit of leaking. However, in the older population, UTIs tend to skip all of those noticeable symptoms and go straight to things like fever and or delirium. So it's almost like you have a very sudden, sometimes temporary, like cognition issue. And in fact, in the hospital, when elderly folks get admitted for sudden or acute confusion or delirium, they immediately get tested for UTIs because it's very difficult to tell the difference between a stroke and a UTI. Unfortunately, if it is a UTI, we treat it with antibiotics. Sometimes that delirium or temporary dementia doesn't fully resolve. So we see that this slowly starts to increase the dementia progression over time. And so UTIs, avoiding like the UTI impact of incontinence is huge. It's huge. And then there's the financial burden. It's estimated that women spend up to $1,500 to $2,000 per year if we consider the cost of pads, liners, pull-ups, wipes, laundry costs, all related to leaking. And for many women, this continues for, like I said, decades into
Yeah.
their later years. But of course, as I'm starting to mention here, the standard medical system is still far behind in understanding the full picture. So the underlying causes of incontinence and the most effective treatment options just aren't really understood very well in the standard treatments.
Mm-hmm.
So they're still off, women are still offered things like anticholinergic medications,
Mm-hmm.
which we also now know now that have an increased risk of dementia and Alzheimer's. So the medications don't address the root cause in the first place. They carry cognitive risks and often come with side effects like dry mouth or constipation, blurry vision, brain fog, to name a few. And so we need to get to the root cause of things.
Yeah, I actually had that diagnosis in my early 30s. I had just finished, that's when I went back to school the first time. I keep going back to school. But I went back to school the first time, and or actually, I guess the second time, and I finished a jazz degree diploma at Mount Royal. And by the end of it, I was having just the urgency and being uncomfortable and frequency, and I talked to my doctor, and the recommendation was to put me on one of those medications.
Hmm.
But when we talked about it, I was like, and I love pharmaceuticals. I love medications. It's really amazing stuff. And, I'm not saying don't take your medicine. Like, personally, yeah, take your medicine. But I said to her, I'm really young. Like, what else can I do? And she was like, well, you can go on the toddler diet. I was like, what is that? And she was like, you can't have it unless a toddler can have it. So, apple juice, milk, water.
Interesting.
That's
Yeah.
what you can have, and you do that for a month and see what happens. Because if you're, using coffee every day to
Yeah.
get through your school program, which I was, it could definitely, we know that it irritates the bladder, and so does alcohol. So let's just cut those things out and see what happens. And no, she was right. That's what it was.
Yes.
You know.
But
So, but lucky
but
me, I had a doctor that listened to me.
exactly, exactly. However, then, because a lot of women, you're right, coffee and alcohol, which we'll talk about bladder irritants in a few minutes, but sometimes things can become bladder irritants that they never were previously. And menopause can change that. We'll talk about that
Hmm.
in a second. But also just other things that have nothing to do with hormones, more to do with our nervous system and that bossy bladder, can then create sensitivity in the bladder that makes us way more sensitive to bladder irritants that we never were before. And so I'm going to guess, with people who are in school a lot, you could be studying a little bit more under stress, less sleep, that sort of thing. And that can set up the environment to be more sensitive to bladder irritants that maybe you weren't sensitive to before. You cut them out, voila, we think that we've solved the problem, which can temporarily, significantly and temporarily, but we always want to get to that even deeper root cause of, well, why did it get sensitive in the first place?
Hmm.
But maybe let's talk about like why is incontinence so related to menopause? Because it is perimenopause, menopause is a time where women will start to feel more bladder issues. I want to be crystal clear that my stance is that menopause does not cause bladder issues. Okay. There are lots of tissue changes and environmental changes inside of the body that will make it more likely to have bladder issues. But we all come with our own baggage as we come charging through the door of menopause. And so it's all of the things that have been layered onto us like a little onion as we come to menopause. That once we have these hormone changes, it's like it pulls back the veil on all these non-optimal things that we were doing or feeling or what was going on in our body that now we don't have that high hormone support to make up for. It's like the
Hmm.
estrogen that we were having before was like our bodyguard, and now our bodyguard's not there anymore. And so we're just much more susceptible. So why don't we talk about some of the things that happens? Well, first of all, lots of tissue changes happen. So the urethra, that's the tube where the pee comes out, it gets a little bit thinner. The pelvic floor itself, it loses its elasticity and collagen. The blood flow to the pelvic floor decreases, and the bladder just becomes a little bit more sensitive. So those sensors that we talked about, they become a little bit more sensitive. All of this will change the closing pressure at that urethra. And remember that balloon, that water balloon thing?
Hmm.
If the seal is weaker, if the pressure is weaker, it means that even a little bit of extra pressure, it's more likely to cause the leak and or the urethra can become more sensitive.
Hmm.
So we also know that the estrogen receptors in that area decrease over time, which means that within and around that urethra, there's less lubrication, there's more friction when you move, more sensitivity in the nerves, a little bit more inflammation, which means that you can trigger an urge reflex sooner and you get that urge a little bit more easily. So this can show up as like leaking when I walk. So that person who made the comment there, this could be one of the mechanisms by why it's happening. Because walking is a pretty low impact activity. It's not like a cough or a sneeze. But if your urethra is a little bit more sensitive, maybe because of hormones, maybe because of something else, that can trigger that like an urge sensation and the bladder lets go a little bit. We talked about this a little bit. The bladder lining itself becomes a little bit more sensitive when estrogen falls, so that things that didn't irritate it before could potentially now irritate it now. And what happens is that the signals and the messages that it sends to the brain through the nervous system are a little bit stronger and they happen a little bit sooner. But the muscles do change as well. So the pelvic floor muscles, they can lose their responsiveness. So they become a little bit more smaller. They're not as quick to contract. The fibers that help them contract really quickly, we get less of them. And so fatigue sets in more quickly. Which means that you can get what I call a tired pelvic floor. Maybe on the first 15 minutes of your walk, you're fine, but on the last 15 minutes, it's
Mm-hmm.
much more likely to have leaking, and that is that endurance. And then the connective tissues around the whole area. So the puppet strings that hold up all of our organs inside of our pelvic cavity, they become a little bit more lax, less stiff, which means they have the opportunity to sit a little bit lower, which we call pelvic organ prolapse, as well as the pelvic floor itself. What used to be a nice kind of bouncy trampoline, it might be a little bit more soft, and a bossy bladder is not going to like that. And that's going to create a little bit more challenges to create that closing pressure that we talked about. But this is the piece that almost everyone forgets, not you, Jessica, because we just talked about this, is that the nervous system changes too. So hormonal fluctuations in perimenopause and even at the beginning of menopause really related to increasing anxiety, stress. Many of us in perimenopause or early postmenopause are in this sandwich generation. So we still have kids that we care about, or are stressed about, maybe are sometimes still at home. And we also have aging parents that we're also now starting to parent as well. So it is a stressful time in our lives. And then if we add on stress through other things that are happening in our body, that can lead to more stress there. Our sleep starts to get disrupted, our cortisol levels are going everywhere, and our sympathetic nervous system tends to start to run the show. That sympathetic nervous system is that fight, flight, freeze, or fawn, that I need to be ready for something scary, big and scary, as opposed to the parasympathetic nervous system, which is that rest, digest, love, and sex, where we are content and cool and calm and no threat is around. But when we're in that sympathetic drive, I need to be prepared for something scary to happen. There are very predictable changes that happen in the body. And this can happen regardless of whether you are in perimenopause or menopause. So the bladder sensors become more sensitive, the lining of the bladder more sensitive, the pelvic floor muscles become tighter, rigid, clenched, just like you had found, Jessica. And we start to alter our breathing. It becomes more shallow. We're not using our diaphragm. Our diaphragm gets stiff and descends down, which can create more pressure around the bladder. And our abdominal muscles become more rigid as well. Not stronger, not like a six pack that looks really functional, but just tight and stiff. And it just puts more pressure around everything. And that will show up as leaking, urgency, frequency, and night peeing as well. The last thing that I'll talk about is about how perimenopause, menopause can impact the bladder are the microbiome changes. So, estrogen feeds our good bacteria in the vagina, the urethra, and the bladder. So, what happens is the good bacteria, particularly lactobacilli, when they're not getting fed by that big level of estrogen, they reduce in their number. And when we have less good bacteria, we can't fight off the bad bacteria or the inappropriate bacteria. And when that happens, we are much more likely to have an increase of UTIs, but then also just makes the urethra more sensitive because even micro irritation from unwanted bacteria that used to get kicked out all the time can make the urethra more sensitive. It irritates the bladder more. It triggers that I have to go feeling, all of that sort of thing. And so all of these things can be influenced by changes of hormones, which is why we may see them a little bit more. But there's lots of things that we are bringing to this menopause party that will actually make all of these things much more likely to happen. What are your thoughts about some of those, Jessica?
Yeah, I feel you on all that, and the I think it's one of the failings of modern medicine that everything is so compartmentalized. And I understand why, because it's a very sophisticated system, the human body. But the more I've learned about physiology, and it's just how could you, what really it was learning about the kidneys and blood pressure that made me think, what are we doing trying to separate all of this stuff? Like, you can't separate the level of, they call it the mental load, right? For the mom who's got a husband or a partner at home and a parent they're taking care of, or more than one parent, or, because depending on who's responsible, it seems the most responsible person ends up picking up all of these things. And then eventually, when the hormones change, we just don't have that, you know, reservoir to draw upon. And we haven't developed the skills of saying, could you take this off my plate? We don't feel comfortable doing that, or we do ask, and the people around us have never heard that before. And so they're dismissive of that, which normally we might be able to just roll with, but because we're depleted, right? I kind of look at it like, the Rocky movie where he's training to go into the ring, and look at the prep time of that movie before he gets into the ring, right?
Hmm. Hmm.
We don't have that prep time before we hit perimenopause, where most of us completely blindsided, and then we end up going through varying degrees of illness and difficulty and trauma and troubles and, you know, tribulations, and then we're supposed to go in and fight with the medical establishment to try to get the kind of care that we personally feel we would want to try, or that we need.
Hmm.
And so I think it's really important to understand that you can't take apart your life like that and go, okay, sleep is just sleep. No, sleep's going to affect everything. The quality of your relationship with your best friend is going to affect how you feel in your life, and having people you can turn to. That's one of the reasons why we started the group, is because I wanted to talk about perimenopause, and not everybody does, and not everybody has to, but there are, I think today we're almost at 13,000 people in the group. So there are people that want to talk about it, and
Absolutely.
understand the impact. So I think it's really wise to look at that from a much more holistic standpoint
Absolutely.
of what we're getting at,
Yeah.
how we're going to take care of ourselves from and I, as a yoga therapist and a coach with women, we just pick one thing. We pick one thing that we're going to address, and then we work on that for 3 weeks, and then we pick another thing, and then we work on that for 3 weeks, and then by the end of 3 or 6 months, depending on how sick they are, that's the other thing that happens all the time. Women wait. I can't believe how much they go through before they actually hire me. I,
Hmm.
I could have helped you in 3 months if you'd come to me last year, but now we've got multiple issues, and they've all kind of piled on top of each other. So I have to even try to figure out, you know, what approach to take that's going to be safe enough that we don't cause any more injury to what's happening for you. So that's why whenever anybody mentions anything about bladder, I'm like, go and talk to a pelvic floor physiotherapist. Don't just go to your doctor, because they'll give you a prescription, which isn't bad. I'm not bashing the prescriptions. But it's just that one thing, right? Like, maybe you need like the whole picture looked at. So,
Whole picture. Well, let's talk about the
yeah.
whole picture then. I'm going to share my screen here. Perfect. Okay. So when you have, this is kind of a nice little recap. I love how organically like flowy this conversation is. So when you have bladder issues, the urgency, the frequency, the inappropriate night peeing, the leaking that we talked about, you have to consider the whole pelvic system, which will include the bladder, the pelvic floor, and their connections to the whole rest of the body, including via the nervous system. And remember when I said nervous system, brain, spinal cord, nerves, and the messages that send back and forth. Unfortunately, what happens is that the standard, traditional, outdated medical system and sometimes pelvic floor therapy approaches, they don't take a look at all of these things. It's like they have magnifying glass and they'll
Mm,
only take a look at one thing at a time.
yeah.
The medical system tends to look at the bladder. So let's give it a medication, let's do surgery or an injection. On the other hand, traditional outdated, not everybody, I promise this, but physiotherapists in the pelvic health industry will only focus on the pelvic floor. Let's do Kegels, or let's do reverse Kegels, or relax the pelvic floor. Maybe let's insert something into the vagina and squeeze around it so we can practice our Kegels. What people are not really taking a look at is how are these things related to the rest of the body? And this is where I find my superpowers really start to shine, is that the bladder and the pelvic floor, they don't operate in a closet all by themselves. They are literally attached to the rest of your body. And what a lot of women don't know, I'm going to stop sharing for a second. So, when we say pelvic floor, we're talking about the floor of this bowl shape here. So, everything you can see here in red, those are muscles. There are three layers of muscles in the pelvic floor. What many women don't know, because we're not taught this about our bodies, is that some of the pelvic floor muscles reach out of the pelvis and they attach onto the leg bone, the hip bone, which means some of the pelvic floor muscles are also leg muscles, and some of the leg muscles are also pelvic floor muscles. And because you can be doing something completely different with one leg versus the other, you can be doing something completely different with one side of the pelvic floor versus the other. So if you've ever had an injury like bunions, plantar fasciitis, Achilles tendonitis, Morton's neuroma, an ankle sprain or fracture, knee arthritis or injury surgery, hip arthritis, anything that would make you limp, for example, this is guaranteed going to create a lopsided pelvic floor, which that bossy bladder will not like, and it won't be able to keep that tube closed where the pee comes out. So a lopsided pelvic floor is far more common than simply a weak or loose one when it comes to bladder issues. Could it be weak? Yes, it absolutely could be. But we find that it is actually much more common to be lopsided or overactive, Jessica, like yours and I's was.
Hmm.
Where if it's too tight, it's too rigid, that bladder doesn't have a nice, soft, bouncy trampoline to jump on, and it can't modulate or coordinate because it's so stiff all the time.
Hmm.
It can't keep that tube closed and it starts to ramp up that sympathetic nervous system as well. And so we have to take a look at the rest of the body. And this frustrates me really a lot, Jessica, because we don't do this with other conditions. If you had chronic headaches, we wouldn't just look at your head. We would look at your vision and your hydration and your pillow and your neck muscles and your shoulder muscles. We have to look at the rest of the body when it comes to bladder issues. And this also shows up in the research, particularly when it comes to the foot and ankle. So if you all want to go out there and just Google, you don't even have to go to a fancy research site, although that would be better quality, but you could just Google for studies between the connection of foot and ankle mobility and range of motion and incontinence, and there is a direct connection there. So we have to look at the rest of the body.
Ooh, I'm just going to reply to the woman that was talking about walking, and just say
Mhm.
because I know that she's trained, so she might really be interested in looking. So,
Yeah.
foot, ankle,
Mobility
mobility,
and range of motion,
and range of motion.
connection to incontinence. Yeah, cut and paste that and see what
Yeah,
comes up. It's very interesting.
yeah.
Yeah. So that's the connection to the rest of the body that nobody's looking at. And as we talked about, nobody is taking a look at the nervous system connection. So, sure, your bladder may be having a hard time filling and holding that urine. Sure, your pelvic floor may be having a hard time keeping that tube where the pee comes out closed. But as we've already talked about, it's the nervous system that's going to drive all of that. Perimenopause hormones, menopause hormones can change that, but so can just other life stressors, bad habits,
Hmm.
even like tension in certain parts of the area around the vagus nerve, around the rib cage, the diaphragm. Those will ramp the sympathetic nervous system up, and that nervous system will drive the symptoms. And so, if we don't address those, it's not going to go away. Kegels won't change that. The anticholinergic medications won't change that. We have to address the nervous system directly because if we don't, then we get an imbalance. We need these two big picture things, a calm bladder and an energetic pelvic floor. Notice I didn't just say strong, it needs to be energetic, have strength, be able to be quick, can relax when we want it to, be coordinated. When these things get out of balance, pelvic system imbalance, as I alluded to, we can get that bossy bladder and or a tired pelvic floor. And both of those things, either or, can really cause urgency, frequency, night peeing, and leaking for sure. So um, I'm gonna stop sharing here. So in full transparency, I do run a online pelvic floor. Sorry, no, it's an online pelvic floor. It's an online program for women with bladder leaks urgency and frequency because I just got tired, Jessica, of like seeing another person come through my door and be like, okay, what have you tried so far? Well, I did the medication and I did the injection, and then I was told to do 100 Kegels a day, and then I was told there isn't anything more I can do about it. I just was like, this is so untrue. And so I run an online program that gets to the root cause of things. I'm happy to share what it like the things that are actually going to make things better is what I would love to share next, if that's okay with
Oh
you.
yeah,
Yeah.
definitely.
Yeah.
Let's
So
help
first of
us make things better.
yes, what to do now? What to do now? Now
Yeah,
we
okay, now I
understand
know it
it.
might be my leg that's not the same length as the other or whatever. You know what I mean? Like a lot of us probably can relate to having had an ankle injury or a foot in the cast or whatever, and have that um, definitely contribute to an imbalance for sure. I can see how that would happen easily.
Absolutely. Absolutely. Well, I wouldn't be doing it justice if I didn't just like nod to hormone therapy just for a second. Vaginal estrogen is the one that's the creams, the inserts, or the rings that you can put inside of the vagina. They are the ones with the best, strongest direct evidence to help pelvic and bladder health. And so we know that it can help with the leaking, with the urgency, everything there. It fixes the microbiome that we talked about, the bladder lining and urethral lining, the lubrication, moisture, the blood flow, the local inflammation, the UTI
Hmm.
frequency. Actually, like we are now saying, like vaginal estrogen is saving women's lives because of the UTI decrease in UTI risk. It's quite astonishing. Basically, it's the direct hit solution.
Hmm.
Um, Systemic HRT, so the patches, gels, pills, that doesn't have as strong of an evidence for bladder symptoms. Not to say that it can't influence it in some way, in some
Hmm.
kind of indirect way, but it doesn't directly prevent the leaks or the UTIs or the urgency, but it can help the sleep and the temperature control and the
Yeah.
mood and the anxiety and then the cortisol. So obviously that's going to help it, but not as directly as the vaginal estrogen does. And
Hmm.
so that is something that I talk about very strongly, that again, there's other causes that are more root than just the hormones, but that vaginal estrogen can go a long way when it comes to bladder issues.
Yeah, I just want
Okay.
to chime in and say
Yeah.
absolutely ask for it. And my husband and I were talking about it the other day, and I said, "Hey, honey, do you think I didn't have any trouble getting my prescriptions? As I said, I'm very fortunate. Have wonderful doctors. I pay a functional medicine doctor for extra billing to take the time to spend with me. She offered me the vaginal estrogen treatment because I was having frequent UTIs from no UTIs for 20 years
Hmm.
to 3 or 4 in a row."
Yep.
Very compelling. This is about estrogen, right? So, and she was right, it is. But for those who are having trouble getting it, if you have a guy in your life, maybe even just get your brother to come with you to the doctor and say, "We can't have sex because she says it's painful. Can we get this prescription?" Because our thought was, if the guy asks for it, then that's an actual problem. It's not a whiny woman, it's a man coming in and saying, "I want to do this, and so we need this prescription, give us this prescription." And so I asked one of the other actually asked a couple of people that work in the prescribing industry, if they think that that would work, and they agreed that they, in their experience, that it would work. So if
Hmm.
you're having trouble getting prescriptions at all, or even if you're having trouble being taken seriously, I had a cardiologist that I felt wasn't taking me seriously, and I brought my husband in for the appointment one time, and I never had that problem again.
Hmm.
So, not it shouldn't be this way, maybe, right?
Yeah.
The system is broken and things aren't, that shouldn't be the case, but that is the case. And the other thing I wanted to just make sure people are clear of is the vaginal estrogen cream. The tipping point for me was when I started to think of it in terms of like using sunscreen on my face or moisturizer on my body. I don't feel bad about those things at all. These are things that I do to protect and help the health of my skin. Why would I feel bad about using a localized vaginal estrogen cream that stays in that area? It's not going to cause you to have too much estrogen systemically. It's not going to make your other symptoms work. It just stays in that area. You put it local, it stays there. It helps out your whole, everything that's going on to stay soft and squishy and moist and vibrant and beautiful and wonderful for, as much as we need that. We need that vibrant, healthy, intimate life to create the confidence to move into the world and enjoy ourselves completely. Not that there's no one right way to do it, and I'm not saying that. If you really don't want to do it, don't do that. I'm sure you're going to provide some options that don't involve using estrogen cream. But if you suspect that it might be an issue for you, please ask to try it. Ask for a 3-month trial. And you'll probably, hopefully, eventually, someone will prescribe it for you. Okay, that's the end of my rant.
Yes, thanks. Love it. I love a good rant. Love a good rant. Okay, so what are some of the things that we bring to that menopause party that we talked about that has nothing to do with, well, I shouldn't say nothing, that isn't the main focus of hormones? So, how about just bad habits? There are so many really bad habits out there even before leaks start, but especially when leaks start, a lot of women will change their behavior that will mask their symptoms in the moment, but actually worsen their symptoms in the long run. Just in case peeing is a big one. I'm going to pee before I leave the house. I'm going to pee when I get there. I'm going to pee, just in case. I don't actually need to pee, but I'm going to keep my bladder empty. Well, of course, if you think if I have less urine in my bladder, then if I leak, it's going to be smaller, or maybe I won't leak, which is kind of true in the moment. But what happens is that when those sensors never get the chance to be fully stretched and triggered appropriately, they become more and more sensitive over time. And so that they will actually start to give you urgency in leaking at even lower volumes and more often. Also, when you get the urge and like just rushing to the bathroom right away, kind of like what you said, Jessica, where I just started to pause and say, is this really a need to go? That sort of thing. Whereas when we get the urge and all of a sudden we're rushing to the bathroom, we're teaching the nervous system, we're like rewarding it for like sending faulty signals, for making us rush, for that sort of thing. And I understand why we all do it. Well,
Mm-hmm.
Lindsay, if I don't, I'm going to pee my pants or be like that woman in the grocery store. And it's not as simple as, and this is another thing that like sort of frustrates me in a very nuanced way. So, like bladder training or timed voiding is something that is often suggested through doctors or nurses, nurse practitioners, where I just want you to delay. But if you don't give the women a strategy and other tools to decrease the urgency and reduce the risk of leaking while you are delaying that urge, they're going to be cursing you later that day. If I just said to you, whenever you get the urge, just ignore it, wait 20 minutes, you're going to have more leaking. You're going to have
Mm-hmm.
more
Mm-hmm.
urgency. You're going to think that you're doing it wrong or something like that. And you're going to be mad at me for suggesting it. We have to give women more better tools and support so that we're reducing the sensitivity, reducing the bossy bladder, making the pelvic floor more energized at the same time as doing these bladder retraining techniques. Drinking less water or fluids. So many women out there are saying, like, if I know if I have to go somewhere, I just don't drink a drop. Or as long as I don't drink much while I'm there, or they just really watch what they're drinking throughout the day. What happens is that dehydrated urine or dehydration urine, which is quite yellow in the toilet,
Mm-hmm.
that will act as a bladder irritant, even in a
Mm-hmm.
in a bladder that's not necessarily super sensitive. It will still act like a bladder irritant. So over time, the sensors get more sensitive, the bladder lining gets more sensitive, we have more urges. So it just is a long term making things worse, which is, in my opinion, not worth it for that moment that you may have less leaking. We know that we need 1.5 to 3 liters per day. If your mind thinks in ounces or cups, that's 70 to about 100, or 9 to 13 cups per day in small sips spread throughout the day, stopping at least 2 to 3 hours before bed, especially if you have a problem with night peeing. But here's the thing, please, 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 if you're like scrambling to write this all down and you're like, oh my goodness, that is way more than what I'm currently drinking,
Yeah.
do not start this overnight
Yeah.
and start drinking that amount tomorrow. You will also be cursing me.
Yeah.
You need to increase slowly and progressively, maybe by like a quarter cup per day, so that your kidneys and your bladder sensors and your bladder have the opportunity to adapt to that, because you'll just be going more often and maybe having more accidents if you try to do it really quickly. Okay. So you all heard that. Lindsay did not tell you to start drinking that overnight. If you do, that's on you. That's not on me. Great. And then of course, like if you're stressed, I'm gonna pee everywhere and I'm gonna be embarrassed. What are you gonna do? You're gonna start holding your abdominals in. We're going to hold your pelvic floor muscles in. But also, many of us, especially those of us who are going through perimenopause and who are menopausal, postmenopausal right now, is we came from an era where we need to suck it in, thinner waist, keep our legs together when we sit, or cross our legs. It's a lot of like
Yeah.
inwards. And the way that we do this is through a lot of abdominal tension, breath holding, and pelvic floor and leg muscle gripping. That is just creating a hard, rigid rock for that bladder who doesn't like it. It can't keep the tube where the pee comes out closed, and it ramps up the nervous system. It will make the leaking and the urgency worse. And so it'll feel really strange, and it takes a lot of work when I work with my clients to really just like soften and allow those muscles to relax and not be crossing your legs every single time that you sit down. Is it bad to cross your legs? Not necessarily, but if you never sit with them uncrossed, that can create a lot of gripping habits there. So, what are the things that we can do about it? So, I'm going to share my screen again because I came up with a method back when I had my issues were at their worst. I tried all the things, all the Kegels, and
Hmm.
then I went to the research and I said, there's got to be a different way. I used myself as a guinea pig. I started to use my patients in the clinic as guinea pigs. Don't tell them that. But I wanted to like create like a system, like at least like just to make sure everything got covered. I put it together. I've been using it in the clinic for with my clients like for years and years, and I put it into my online program that I've been running for about 2 years now. I call it the Bladder Confidence Method. So the first phase of the Bladder Confidence Method is what I call reset. This is where we break all of those hidden bad habits. I've mentioned just some of them here today that are
Hmm.
secretly making your bladder control worse.
Yeah.
And so a lot of women come to me, they're searching for the perfect pelvic floor exercise program, not realizing that your habits train your bladder more than your muscles do. So with this reset phase, you'll be able to walk out the front door without the stress and anxiety of like mapping out every bathroom that's on your route. The second phase is what I call rebalance. This is where we do lots of different activities, particularly with the nervous system, but other things like we talked about the abdominals and the feet and the hips and the diaphragm to calm the bossy bladder and energize the tired pelvic floor. It's not about doing more Kegels, because if your pelvic floor is already tired and out of
Hmm.
balance, more squeezing only makes things worse. And so you need to be able to take a look at everything in the body so that we can rebalance that. And then the final step is rewire. In this phase, this is where you need to rewire that brain bladder connection. And like I said, there is there is truth in being able to delay going to the bathroom, but giving people techniques to be of what to be able to do while you're doing it is really, really important. And so, what I'm going to go through is something that we can do if we are experiencing urgency. Okay. So, the first thing that I suggest doing is when you experience urgency, just stop and sit down. So, if you can sit and put some pressure on your pelvic floor, it helps break that reflex, that message system that we talked about. We then want to calm the nervous system and stay calm. So, some nice deep breathing is a great way to do that, as well as finding like a calm mantra. So, I can do this. It's just my bossy bladder. Something that you're either saying out loud or thinking does a couple different things. For one, it keeps us calm. For
Hmm.
two, it's us using our frontal lobe, which is where some of those messages that are causing the urgency, they're here in the back in the hindbrain, the lizard brain, as we call it sometimes. And we want to get it to switch to the frontal brain because it can actually help turn that off. So once we've done that and we're sitting, we can do 10 quick pelvic floor contractions. So 10 quick little Kegels. When we contract the pelvic floor muscles, and it doesn't matter how perfect you do them, don't worry that you're doing them right or wrong. Everybody's all very worried about that. Just contract them. You're going to be doing something even if they don't feel perfect. What that signals to the nervous system is like, oh, it's not time to let it out. It's time to keep it in. So it stops that message. And then from there, that's when we want to distract ourselves with something, keeping that frontal lobe going while we wait. And I suggest waiting and starting with about 5 minutes. So during that 5 minutes, we are going to stay calm. We are going to try and distract ourselves to get into the frontal lobe. And once that 5 minutes is up, then you can get up and go to the bathroom. Because even though you are eventually emptying your bladder, you're teaching the nervous system that was not appropriate what you just did. Kind
Yeah.
of
No,
like how
thank
I
you.
talk to my kids
Yeah.
sometimes. That is not an okay way to talk to me. But it's really that. And so we want to like reteach the nervous system about what is appropriate and what is not.
Yeah.
And then over time, what we do is slowly increase that 5 minutes to longer time increments. And so that, again, these strategies that I just walked you through should reduce the urgency in the moment so that you're not just white knuckling it and like hoping that you're not going to leak in the meantime. So I have that process for you. And I also have let me just share my screen again. I also have that I would love to share in the group a little handout, a 10-minute routine to stop bladder leaks urgency and frequency. This 10-minute routine has a little bit of everything, something for the foot and ankle that we talked about, something for the nervous system, something for beyond the pelvic floor that really gets to all those root causes. It's quick, it's easy. You don't need to go to the gym. You can do it from home so that when you're working on some of the more physical reasons of the bladder issues, then you can do that there. So I will send that link to Jessica, and maybe Jessica, you can post that somehow in here. And so I would love if everybody took a look at that.
Yeah, that's great. That's so great because that's the, you know, information is good. Knowledge is power. I really firmly believe that. But part of it is also what what I'm really emphasizing is like what can we do and simple, hopefully easy to remember, like sitting down, that's fairly easy to remember. I mean, you might not always be able to do that, but if you can start incorporating that a little bit and then my favorite thing for calming down is listening to music because it doesn't really matter what you like. Just find something that you like. I have a tongue drum exercise that I did that is up on Insight Timer where I'm a musician as well as a yoga therapist, and I started thinking about like, how is there a way that we can listen to something that will tell the nervous system to calm down that doesn't require any kind of focus or concentration because
Exactly.
brain fog isn't so great for that. And so I started experimenting with groups of twos and threes, and then I put it up and I started working with people, and it works. It works. It's totally, and you don't have to sit there and like focus and concentrate. You don't have to anything. You just listen to it. I had one client who would listen to it while she was doing her bookkeeping because she was having a lot of anxiety about making mistakes and worried that she was going to get fired.
Mm-hmm.
So she would just have the track on in the background while she was doing her numbers, and it made a really huge difference. So what I'll do with that, you send me the link, and I'm going to put this into the School of Perimenopause. Anybody who hasn't joined, you're missing out. There's over 130 items in there now, and 10 different speaker meetings of people like this, experts coming in and sharing wonderful information, and that's all at the free level. And then, if you want everything, you can subscribe to Gold. And there is a 50% off sale going on right now for memberships at the School of Perimenopause. So I'll make sure that you'll be in the speakers tab, and then when they look at your video at the bottom of it, I'll put the link so they can actually go and do some of the exercises themselves and check that out, and then be able to connect with you. I'm sure that all of your contact stuff is in there so they can, you know, don't give up on your bladder. Your bladder health is important. This idea that it's just part of aging. I think a lot of that stuff that we think is just a part of aging, we should throw that phrase out into the garbage, because a lot of it is just putting up with stuff instead of being active in our lives and moving forward in a way that's healthy and sustainable, right? We can do this for a good long time because we want to live a good, long, healthy life. I don't, you know, like that was my big turning point for going into more holistic health. Was the medical establishment as it is will keep me alive into my 80s for sure, and I will be sick from about 45. Do you know what I mean? They'll keep you alive, but they won't help you to be well.
Hmm.
So I didn't want to be, and I don't want to be, you know, the lady sitting in the corner kind of out of it and, you know, really unable to enjoy my life but still alive. No, thank you. I'd like to be the lady that's surprising people right up until I just croak one day. That's
Yes, yes.
till I'm like, okay, I'm ready to go. I'm ready to transcend to the next level. But that's not now. And I think you just did a great job of spelling it out for us in a way that, you know, is beautiful. It makes perfect sense to me, and it aligns with everything that I've learned about the human body and how it's all connected, and how we need to take care of the whole person and not just, you know, their eyes or, you know. So
Exactly.
thank you so much for offering to come and talk with us.
Of
And
course. Thank you
I will
for
let you
having
know
me.
if anybody sends me messages or anything like that. I'll just forward them on to you so that you can help them as much as possible.
Perfect.
Yeah. Is there
Right.
anything else you wanted to say before we go?
That is everything. I've had a
Awesome.
great time. Love chatting with you every single time, and we will
Yeah.
do this again.
Yeah, well, we're best friends now again, so everybody keeps saying it's hard to make friends when you're older, and I'm like, I don't have any problem making
Yeah,
friends. I just,
exactly.
it doesn't mean that everybody becomes my very, very best friend, but I've made so many wonderful like just connections with women. I talked to a woman yesterday who's a naturopath, and she's from Australia. We've never met, but we've talked, you know, and I've worked with her a little bit, and it's interesting how I think we have too much of a rigid idea about making those connections, and they have to look a certain way. Let's just be open to the wonderful way that people are different and connecting in a different way. I don't feel like I'm not with you because we're on Zoom,
Hmm.
you know?
Yeah.
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 Okay. So I'm here for you if you need me, and
Great.
we'll talk again soon. So the only way I know how to end this is to just end the meeting.
Just
So we're
end.
gonna, yeah, it's
Okay.
going to be this.
Cut.
So go and enjoy your lunch or whatever you've got to do next, and we'll talk again soon.
Okay.
Okay.
Bye-bye.
Thanks. Bye.